Okay, let's get right into it. When someone you love is being treated for COVID, you put your trust in the doctors. But what do you do when the treatment itself seems to be making things, well, a lot worse? We're going to arm you with the critical questions you absolutely need to ask to protect them. It is a really scary thought, isn't it? But it's a question we have to be brave enough to ask. Because sometimes the mix of medications can create a brand new danger that's even more immediate than the virus. So we're going to dig into how you can spot this and exactly what you can do about it. All right, let's look at a real-world case to see how this plays out. We've got a 75-year-old woman. She's tested positive for COVID, but her biggest problem right now, the most dangerous thing happening, is what's being called excessive diarrhea. And on top of that, there's a worry she might have something called silent pneumonia. So what's really going on here isn't just one single thing. No, it's more like a perfect storm. The combination of drugs she's been prescribed, for the virus, for other potential infections, they're all ganging up to create one single, really dangerous side effect.
And this right here is the absolute key. For a 75-year-old, the number one threat right now isn't actually the COVID virus. It's the severe diarrhea. That can lead to dehydration, kidney failure, you name it, and it can happen fast. That's the fire we have to put out first.
Okay, so first things first, we have to ask, what is causing this and how on earth do we make it stop? We need to investigate the immediate danger.
And check this out. This is where it all starts to make sense. Every single one of these meds can contribute. Paxlovid, famous for it. Amoxiclav, the antibiotic, wrecks the gut. Fluconazole, more stomach upset. But then you get to Reglan. It's a prokinetic. You know what that means? Its entire job is to speed up digestion. It's literally like pouring gasoline on a fire.
So this becomes your first move. This is the exact smart question you ask the doctor. You're not pointing fingers, you're showing you understand what's happening, and you're focused on the immediate danger. You're asking a targeted, safety-first question about pausing the one drug that's actively making everything worse.
Okay, now that we've tackled the most urgent problem, we can peel back the next layer. Is she even being treated for the right thing? This brings us to question number 2, and the hidden danger of a possible misdiagnosis.
So to get this, you need to know about something called silent hypoxia. And honestly, it's terrifying. It's a classic feature of COVID in older adults. Their oxygen levels can be dangerously low, but they don't feel short of breath. They're not gasping. This is why you, the caregiver, have to be the detective in the room. And this slide just lays it all out plain and simple. COVID causes viral pneumonia. The antibiotic she's on, amoxiclav, that only works on bacterial pneumonia. So think about it. She's suffering all the awful side effects of a powerful drug that is having zero effect on what's actually wrong with her. It is all risk and absolutely no reward.
And here's the thing. Finding out for sure is so straightforward. You don't need some complex procedure. A simple chest x-ray and just checking her oxygen levels with a little pulse oximeter. That's it. That's the proof you need.
And here it is, your second powerful question. See how precise it is? You're respectfully asking for evidence before continuing a drug that is causing direct, measurable harm. You're connecting the dots for them. This treatment is causing this problem. All right, on to our third and final line of investigation. Let's look at the main event, the antiviral itself. It's there to fight the virus, sure, but we have to make absolutely certain it isn't creating a totally new hidden risk. And I need you to really pay attention here. This is a big one. Paxlovid is an amazing drug, it's very effective, but it comes with a massive red flag, especially for older patients who are almost always on other daily medications. Just look at this list. Statins for cholesterol, common blood thinners, heart meds. I mean, how many people over 70 are taking at least one of these? A lot. And an interaction here isn't a small thing. It could be genuinely toxic. It could be dangerous. Now, the good news is you're not stuck. There are other options if Paxlovid is just too risky. There's remdesivir, which is given through an IV and has way fewer interactions, or molnupiravir, which is a pill. It's a little less effective, but it's also much safer when it comes to interacting with other drugs. So this is your final investigative question. You're not just asking, is it safe? You are asking for confirmation that someone has done the work, that they have physically cross-referenced every single one of her other medications to check for these dangerous interactions. We've gone through the questions to ask, but now we have to talk about the most important part of all, when you stop asking questions and you call for help immediately. These are the absolute, non-negotiable, drop everything red flags. Seriously, If you see any of the signs we're about to show you, don't hesitate. Don't second-guess yourself. The only move is to call 911.
First up, any new confusion, if they suddenly don't know where they are. Next, any difficulty breathing at all, if they faint or can't stand up. If you see a bluish tint to their lips or face, that's a direct sign they are not getting enough oxygen. Any blood or pus in the stool. No peeing for more than 8 hours, that's a huge sign of dehydration. And finally, if you have a pulse oximeter and that number drops below 92%, any single one of these means it's an emergency.
Look, when you're in a situation like this, it's so easy to feel completely powerless. But what I hope you see now is that you're not. Being an advocate, being armed with these specific, smart, targeted questions, that might be the most powerful tool you have. It can ensure safety, it can clarify treatment, and it just might be the most powerful medicine of all.